Today we're here with Simon McMahon from Headspace to tell us a little bit about stress, anxiety, and in particular how mental health can affect young women. Well, thanks for having us here today, Simon. Can you just explain what the figure 1 in 4 or 1 in 5 people experience a mental health problem actually means?
Okay, well thanks for having me. 1 in 4, 1 in 5 actually means that in any 12-month period people will be experiencing either depression, anxiety or substance use or any combination of those mental health conditions. So it excludes your personality disorders and psychosis, which is things like schizophrenia.
Are there any types of health problems that are experienced more by females as opposed to males?
Yes, across the population, anxiety disorders are experienced at more than double the rate of depression, but within the age groups and the sexes, anxiety is experienced at more than double the rate by females. Stress and anxiety are largely the same thing. If you were to write down a list of stress symptoms on a board and then next to that write down a list of anxiety symptoms on a board, you'd invariably come up with a very similar list. Stress and anxiety are largely the same thing. Depends whether you've got a problem with it, depends on how much interference it's causing in your lives. Some of the symptoms of stress and anxiety are common and we experience them on a day-to-day basis, and some of them are even good for us and positive for us, help us achieve things. Whether it's a problem depends on how much interference it's causing in your daily life or how much disability it causes in your normal functioning during the day. So for instance, if you're getting really poor quality sleep night after night and you're becoming quite irritable during the day and you're not very much fun to be around, then it's obviously going to start having an impact on your relationships, and that's where it starts to have some interference in your daily life. And similarly, depression is also experienced at more than double the rate by females than males, but conversely, substance use problems are experienced by males at about 3 times the rate of females.
And exactly how many people would you say actually seek help for these problems?
Statistically, about 33% of people seek help for mental health problems, and there's evidence suggesting that that hasn't changed over about the last 10 years or so.
Simon, what are some of the reasons why people wouldn't actually seek help for these problems?
There's many known reasons why people don't seek help, and they include things like stigma, which includes embarrassment and shame. And there's 2 types of stigma. There's self-stigma and perceived stigma. So stigma about views that you have about yourself, and then there's views that you think other people will have of you for seeking help or having a condition. Another reason why people don't seek help is because they don't realise that what they're experiencing is an actual diagnosable mental health condition, or the early warning signs of. That's highly treatable. Another reason includes people don't know a great deal about treatments and how they work and where to find particular types of services that they need. And another reason includes people's ability and willingness to disclose some of their symptoms to the source of help.
Simon, can you briefly explain some of the treatments that are available for mental health problems?
There is a wide range of treatments available. Some are more effective than others, and it's important to note that not all treatments work for all people. You do need to find the one that works for you and keep at it. The main therapy that's used is called cognitive behaviour therapy, and that exists because we know that people with anxiety and depression have certain ways of thinking that contribute to their anxiety and their depression, and by learning to be aware of these ways of thinking, these harmful ways of thinking, and correcting them, that's the main way to treat anxiety and depression, and that's what cognitive behaviour therapy is about, and that's what a well-trained therapist can help you to achieve.
And what can people do if they're experiencing mental health problems?
Okay, the main option that we recommend is that they see their doctor, their family doctor or GP. They're the people who are best placed to make an assessment of the issues, and then they can do what's called a mental health treatment plan, which can act as a bit of a referral to other sources of help, such as psychologists or social workers delivering cognitive behaviour therapy and other types of therapy. So the main option is to get off to your GP and ask for what's called a mental health treatment plan.
Sure. Well, thank you, Simon, for the useful information, and hopefully our viewers have actually learned a little bit more about this topic today.
My pleasure. Thanks for having me.
As you can see, there is no stigma associated with mental health. Consult your GP or healthcare professional for more information, and if you'd like more info on this segment, check out our website.